Babies born prematurely usually need to spend time in a neonatal intensive care unit, or NICU. With preemies, it's important to know these facts. Breathing problems happen because their lungs aren't fully developed. Your baby may be given extra oxygen or hooked to a ventilator or something called a CPAP machine. Many preemies also stop breathing occasionally, a condition called apnea, but in a NICU, they're carefully monitored for this. Because preemies have less body fat, your infant will probably be placed in an incubator to help her control her body temperature. There can be feeding difficulties. Until she learns to suck effectively, your baby may be fed through a tube, but the nurses can still give her any breast milk that you pump or freeze it for use in the future. Also, preemies usually take longer to reach milestones like rolling over, and they're more likely to have learning disabilities. Regular checkups will be important so you and your doctor can detect problems early. Early intervention, which can include physical therapy and speech therapy, can make a big difference. Be sure to ask questions as many times as you need to. And remember, with today's medical advances, chances are that your tiny little baby will grow into a healthy, normal kid.
Chemoreceptors in the carotid and aortic bodies monitor blood oxygen, carbon dioxide, and pH. Impulses from these chemoreceptors are conducted to the control centers for heart and blood vessels via the glossopharyngeal and vagus nerves. Decreased blood oxygen, increased blood carbon dioxide, or decreased blood pH decrease parasympathetic stimulation of the heart, which increases the heart rate. Decreased blood oxygen, increased blood carbon dioxide, and decreased blood pH increase sympathetic stimulation of the heart, which increases heart rate and stroke volume. Increased sympathetic stimulation of blood vessels increases vasoconstriction. If chemoreceptors of the carotid and aortic bodies are stimulated by decreased blood oxygen, changes in autonomic impulses to the heart and blood vessels result in increased heart rate and stroke volume and vasoconstriction.